Ask Reddit on Reddit Rundown. Doctors of Reddit, what are the dead giveaway signs that someone is faking? Nurse here, I had a teenager overdose on Zoloft and start having strange seizure-like episodes. What made them particularly strange is that they all followed a predictable pattern of onset. First, he would lower the bed, next he would turn the TV volume down, and finally he would check to see if I was nearby. There was pretty severe thrashing about without any abnormalities in breathing, heart rate, pupils, and he was still able to communicate with me throughout the entire episode. Unsurprisingly, EEG also failed to show any abnormalities. One time I was in hospital with decompression sickness and neurological damage and I couldn't piss. I told a nurse I needed a catheter, which she did right away, and I filled 3-liter bags straight off. Anyway, she commented that if a man actually says he needs a long tube pushed up the hole in his penis, then you can be sure he needs it done. Whenever the symptoms aren't there when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently, after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild, y'all. My wife is a doctor and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, "Now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison." While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove their right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. Not a doctor but a paramedic. Tons of calls to the jail for inmates with seizures. I lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes and they'll twitch to it. Not a doctor, but doctors often think my family is faking. For an unknown reason, when there's something wrong with our organs, our white blood cell count doesn't go up. My younger sister got appendicitis when she was in her early teens. Crying from the pain, but blood work showed nothing was amiss. If it hadn't been for other tests and my dad's insistence on them, she might not have been treated in time. So, they open her up and surprise. A gross appendix that was close to bursting. My dad insisted because of an operation he had just had to remove his gallbladder. He was in so much pain that he was vomiting, could hardly walk. It had been building up for a while and he was pretty sure what it was. He went to the doctor, but blood work showed his white count was normal. My dad had to scream in agony on their table for ages before they finally gave in and took him to surgery. They go in, see a perfectly healthy looking gallbladder. They pull it out, cut it open. And sand spills out. Dry sand. We learned later that it had completely stopped working and totally filled with protein chains. It was removed before it started killing my dad in earnest. So yes, people fake it, people lie. But do double check just in case. I'm not a physician but a paramedic. Honestly, I don't really care if you're faking as long as it's halfway believable. I'm still going to treat it as the worst case scenario. Faking a seizure? You'll get a full set of vitals, a blood sugar and a shot of benzos. There's lots of different types of seizures. If you call 911 because you're in extreme pain and want an ambulance ride, I'll put the good drugs in your vein hole. I'd rather give 100 drug seekers a 100 micrograms of fentanyl than withhold it for the one person that really needs it. Can I tell if someone is faking? Yeah, most times, but it goes both ways. If you go too hard, I might assume you have a legit life-threatening injury and sedate, paralyze and intubate you. Or start fours in your jugular or shin bone. Fake it if you want, but traction may vary. You can be faking good too. Had a tooth kicked out. Mouth filled with blood and swelling. I'd stuck a tissue in to try to stop the blood. I've presented to the triage at the dental hospital. I'm dribbling blood as I talk. She asks me if it hurts and I said a little bit. She looked at me dead in the eye and said one of the many things we triage on is pain. Gotcha. Good nurse. Hurts like a motherfucker. I've literally been kicked in the face. Thanks for that. Notes taken. Was patched up and out of there within an hour. If someone is unconscious, make a fist and rub your knuckles against their sternum, chest bone. Put some pressure behind it and rub quickly up and down, up towards chin, down towards belly button. It's called a sternal rub and is incredibly painful, but won't harm the person. It's very hard to completely ignore and continue with the ruse of faking being unconscious. The only sure thing is asking your partner to hand you the eye needle to take some ocular fluid while they're passed out so they won't feel the pain of the needle in their eye. ETA, there's no ocular needle, at least not on an ambulance. We say that because not everyone knows that and they don't want to risk it. ETA 2, RIP my inbox. Apparently, the sternal rub isn't common practice anymore because people literally went too hard. Sorry. Also, I feel old AF now. Not a doctor, but I once had a nurse tell me something that stuck with me ever since. I had a gallbladder attack when I was younger, and let me tell you, that's some of the worst pain I've ever felt. I was doubled over, vomiting bile, and unable to move. My mom took me to the ER at 1 a.m. in the middle of a snowstorm. As the nurse was doing my initial evaluation, she asked me the standard on a scale of 1 to 10 pain question. I thought for a couple seconds, and told her 7 or 8. It hurts really, really bad. She nodded knowingly, and told me got it, it hurts really bad. Most people who tell me 10 are lying. No one ever feels a 10. In hindsight, I'm not sure that's the best practice for a nurse. Still, after seeing drug-seeking patients myself, I understand her frustration. They ended up giving me morphine, which brought that number down quite a bit. Most often their story/description/exam doesn't make any sense. There are usually things that contradict each other. Abdominal pain is generally easy to tell when people are faking it. For example, I will press with my stethoscope instead of just listening. They don't respond to that pressure but will when I use my hands instead. Sometimes I'll ask them if they are experiencing a symptom that will rule out a diagnosis or make it less likely, and many times, they think I'm asking it to support their supposed issue, so they will say they have it. Most of the time people aren't faking but just blow their symptoms out of proportion. A nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking telling them I couldn't swallow my own saliva, the nurse just told me yes, you can. This surgery wouldn't have anything to do with your ability to swallow. I could also barely speak and started crying and pleading with her to believe me. I ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a doctor not believe you during trauma is absolutely scarring. I once had a patient with appendicitis. Every time I prodded him, to check whether he actually had it or not, it would pain in different spots. Soon, it got to a point that wherever I prodded him, he screamed like a stuck pig. I mean, that's a dead giveaway sign that someone's a faker. Brief note for all the student doctors out there, people can pass stroke field tests and still not be having a stroke. I could do everything on the list while I had a clot in my brain, verified by CT and MRI. Except I couldn't stop vomiting. Good times. Be aware sometimes shit doesn't look like you think it should. As a patient, it's apparently very sus if you say you don't want an oxy script. I had some shit happen, doc started filling one out for me, and I told him not to bother, since I wouldn't fill it. He got annoyed and said he wouldn't prescribe anything stronger. I got annoyed and said I didn't ask for anything stronger. For fucked reasons, oxy/hydro/codeine don't work for me. Advil literally does more for me than any of those, so I'll just take ibuprofen. But apparently the way I phrase that makes doctors think that I'm asking for better meds instead of explaining that I'm just not going to bother with the worthless ones that they default to. When their allergy list is 30 medications long and their reactions to said medications are things like total body numbness or something that isn't mechanistically possible, and they come in with a painful syndrome that isn't mechanistically possible. They generally claim that their body is special and that no scientific training we get applies to them. They also claim everyone is out to get them and like to tell me stories of previous doctors they hated, rather than helpful information. There are two reasons people do these things: secondary gain, requesting opiates for a high, or psychosomatic reasons. Stress causes a physical response rather than a pure mental one. The latter is real pain and not sinister in motive, just not organic pain that is a sign of true organ injury. Honestly, my wife just needs to show up at emergency, and for some reason they always assume she is faking. A nurse tried to discharge her when she had an ectopic pregnancy, saying it was the stomach flu. 4 hours later she was in emergency surgery. She has hyperthyroidism, but nearly all male doctors don't believe it's a real condition, so keep trying to take her off her meds or reducing them. Apparently this is somewhat of a common issue. She recently fell in the stairs and fucked her leg up. It took 4 A&E visits before they x-rayed her leg despite the swelling and bruising. She was sent home from hospital when we first got together and had blood poisoning, collapsed on the tube on the way home and straight in an ambulance for another 3-day stay in hospital. It's a nightmare to watch, as it's almost guaranteed at this point, they will not take her seriously. Vital signs. If you say you're in excruciating pain but your heart rate is 65, then I'm pressing X and doubting you. If you are short of breath but you are breathing at 12 times a minute, normal instead of fast, and your oxygen saturation is 100%, then the problem isn't in your lungs. Anxiety can present like this, which isn't faking it, but it requires seeing past what the patient is telling you. If you tell me you've been clean from meth for a month but your heart rate is 120, then I'd like you to pee in this cup. When I was doing my EMT clinicals, I was 17, still in high school. We had a guy who called 911 reporting crippling back pain. It was immediately obvious when we got there that he was faking a back injury. We did an evaluation and gave him some OTC painkillers, but he asked to be carried to the hospital. The whole way there he begged for something stronger to ease his pain. After a while, the medic said, "Okay sir, unfortunately we don't carry morphine on the bus, but I'll give you an alternative that we use sometimes. It's called Normalzolin." He hooked up and within a few minutes the guy was totally fine, telling the medic that it was good stuff and he was feeling much better. Later, I went back and asked the medic what he had given the patient. I had never heard of it before. He laughed and said, "Good old Normalzolin." I remember one time a person came in, they said they were having trouble breathing and could barely walk. I said, "Okay, come walk with me and we will see what I can do." They started limping and putting on a whole scene. I said, "Whoa, look at that thing." It was a bird in the building. They went wow and looked at it for about 10 seconds and I said, "Oops, I've gone the wrong way. Quickly, let's go this way." They turned around and started walking absolutely perfectly. They continued to walk for about 3 minutes to the other room and I said, "So what's the problem again?" And they said the same thing. Fuck. I am in the middle of being treated like I'm faking and it's really frustrating. I had a tool slip at work and hit me in the eye and forehead. Knocked me out for a second and I lost sight in my eye. An hour later I started getting my sight back, but it hasn't fully come back. It's been months now. 2 things I got diagnosed with were ocular migraines, and vitreous detachment. And a concussion. But none of those things explain why my vision is still blurry in my right eye. Except the VD, which causes floaters, but my issue is blurry vision, like I have Vaseline in my eye. But doctors keep telling me I'm fine. That I need to go back to work. One doctor told me to think about the economy and that I was lucky to have a job right now, so I quit my job. I still want to see out of my right eye, but none of the doctors are taking me seriously. Obligatory, not a doctor, but I got a call from my son's school nurse when he was in 2nd grade, and the conversation went like this. Nurse, sounding upbeat and cheerful, says, "Your son wants to tell you his terrible news." Son gets on the phone, says, "Hi mom, I cut my finger off." I ask him, "Where is your finger now?" "Son, I put it back on." I said, "Can I talk to the nurse?" Nurse gets on the phone again, says, "Sounds serious, right?" I asked, "Does he have a substitute teacher today?" "Ah. Yes." I told the nurse to let him know I will take him to the hospital for a shot for his finger, to which he says, "I think it's okay." I glued it on really good. Nurse kept him in the office for a bit to talk about scary changes in the classroom. My wife is a nurse and used to work on an adult unit, now works in NICU. She said there used to be drug seekers that would come in stating they were in the worst pain they had ever felt and they needed pain meds for it, often asking for a specific drug. After leaving the room to talk with the doctor and getting the appropriate prescription filled, or denied, upon her return to the room to give the patient their drugs, she would often find the patient soundly sleeping in their bed. Someone who was in tense pain 15 minutes earlier is now just taking a nap. A lot of the doctors would tell her to just spill out the drugs, and give the patient some saline, then send them on their way. The opiate epidemic hit our part of the US pretty hard. I worked in the ER with this one doc. We had a guy come in unresponsive with his GF. For the GF, they had both eaten a weed brownie and then when they didn't feel anything ate 2 more. Big mistake BTW. She was hysterical and convinced he was dying, kept wanting us to send him to surgery, and do what? Dude would not respond to anything but was absolutely fine. Doc ordered like 2 liters of saline 4, turned to me and said we'll see if he's dedicated to this bit enough to piss himself. Sure enough, half an hour later and my man is up in an M and sprinting to the restroom Lamau. If you like the video, give a thumbs up and subscribe. And check out other videos on my channel. Thank you and have an awesome day.